Hi, I'm Randy Alvarez. You're watching this week's Randy Alvarez Marketing Report. With us, we have one of the most successful medical doctors that I've ever had on my program, and that's Dr. Kingsley. Dr. Kingsley, welcome to the program.
Thank you.
Now, we should mention a few things about you. You're a board-certified vascular surgeon,
Great.
which mostly vascular surgeons won't even talk to me, so it was
see.
good. But you're a businessman as well. I mean, you have a lot of medical doctors working with you. We should mention you have one of the busiest, probably the biggest vein practice in the world. Is that right?
That's,
okay.
Yes.
Alabama and Atlanta Vascular. Give me the name again.
Alabama and Atlanta Vascular and Vein Centers.
Okay. You know, I always ask the doctors, and we share every week little tips. Now, you know, I said, you know, what is your secret? Is it because you're just a good businessman? Is it your technical skill? Is it because you're a vascular surgeon? Is that what makes you busy? Because you're a vein doctor, doing leg veins, things like that? And I loved your response, so I'll ask you again.
Well, my answer to that is that no matter how good a surgeon I might be or how good a medical doctor I might be, unfortunately none of that has anything to do with the success of my practice or my businesses. My success has been my ability to talk to patients, to communicate with patients on any level. To the university president, to the farmer on the ranch. And that skill has sustained me for a fairly long career.
Did you have to study communication, by the way?
No, some
or
of that.
read some sales books, or tell me about that.
Well, I think a lot of it is inherited. A lot of it is environmental, the family you grow up in.
Okay.
My father was a minister. My brother is a college president. And those communication skills you may develop outside of anything you do professionally. But then I learned quickly that those were really the keys to success. I could do some large aorta reconstruction on someone and make them awfully comfortable just by talking to them and explaining to them that this is what I'm about to do, this is what your expectations are.
Do you think there's not enough of that going on? I mean, look, and we should also mention you lecture internationally. I mean, doctors from all over the country learn to do veins from you.
They do.
And what do you say to the person that's just doesn't have, you know, look, they don't have the big personality.
Right. Well,
their dad wasn't a preacher.
I tell them that they watch me, when they come to my center, they watch me roll the patient out to the car in the wheelchair. And they ask me about that. Why are you doing that? Why do you not have an orderly? And I say, listen, it's often the only thing the patient remembers.
Is that right?
They don't have a clue what I did in the operation. I could have done an incredible procedure, and they have no earthly idea. But they really know I took them to the car, and I cared about them, and I was there to assure their safety.
And they tell you about that afterwards.
Oh yeah, I hear that more than anything else.
Really? And that makes you stand out. Look, all doctors are trying to differentiate themselves and stand out. You know, TV does that. By the way, how was our show done for you?
Very well, by the way. I ran the show in Birmingham and in Atlanta, and in Atlanta I have more referrals from the show than from any other modality, whether doctor letters or whatever I've done. I have a larger response from the Wellness Hour TV show.
But doctors aren't supposed to advertise. Good doctors.
Well, that's an old school. The good doctors need to modernize a bit, because you have to be a good businessman if you want to be successful. You can always make a living, but if you want to be a good, successful businessman, you have to advertise like every good business.
Like Mayo Clinic or anybody else?
All the big medical organizations advertise. They advertise they're the greatest and the best. In our location, University of Alabama, Birmingham advertises they're one of the top echelon.
But didn't you worry about what all your colleagues were going to think if you go on a so-called infomercial, even though these are real interviews?
Well, you always worry a little bit, but...
Did you worry about that?
But not a whole lot. I really didn't, because my focus is my patient. I mean, my colleagues envy me now, many of them do, whereas when I first started some of this, they were quite critical. Now they wish they had done what I have done. Now they call me and say, how can I do this, you know? Because in medicine's tough these days, and a lot of doctors have seen their income drop precipitously. And in fact, my colleagues in vascular surgery have seen that, and simultaneously my income has gone the opposite direction. And In fact, to the point I often will be quiet and not tell them exactly what I'm doing. And
Is that right?
You sure? Because
You don't like them to know
I'm
about the
doing
wellness
quite
hour.
well.
Thanks.
They may not be doing so well yet.
But you know, I have a lot of doctors that are afraid of TV, putting themselves out there. I mean, I've just recently learned this hidden fear about putting yourself out there in general. What do you say to people about that?
Well, some is the fear of criticism from colleagues, and surgeons in particular depend on doctor referrals. They don't want to be criticized.
Have you had any of that?
Well, a little bit, but it's not.
Any compliments? Saying, I saw your...
Yes, in fact, you'd be surprised how many physicians' leg veins I have corrected because they saw the infomercial.
Is that right?
Not only that, they were educated by the infomercial. They would call and say, listen, I saw your show. I never knew that information. And then they send their patients once they are educated, see. So
that's a side effect.
It's a good side effect.
You get more. Okay, so the biggest tip you can give doctors, they're slumping. I'm the marketing guy that always tells doctors, if your practice is slow, here's the bad news. It's probably because of you. Do you believe that?
I do believe that.
You do?
Yeah, I think that the old staid, outdated doctor who wants to sit in his office and expect patients to come and doctors to refer patients, that's a long gone entity. A modern doctor, if he wants to be successful, has to communicate first. He has to learn how to speak to his patients, get on their level. If they fish, talk fishing if you can. If whatever they do,
be yourself.
Be yourself and understand what they do. Mostly be yourself, exactly.
You know what I like about this, by the way, because I'm looking at you and I'm thinking they're going to look at this guy. The number one thing, people get intimidated, let's say by this guy Bill Dorfman that's on my show, big personality, or some other big personality. And I always say it doesn't matter. Just if you're honest and you're an expert at what you do, like you're not this big dynamo guy.
No, and I don't want to be.
And very successful.
Right. Yeah, I prefer not to be on the podium at the National Society. That's not my love and not my forte. I talk to colleagues and we talk business. I get emails every day from doctors all over the world, questions about mostly medical issues, but a fair number about
biggest
business.
mistake they make in their practice is what?
In terms of business success?
Overall, that's right.
Retract. They retract. They don't put themselves out to the public. That's the biggest mistake.
Wow. And that's our train in the background. We normally stop for that. So they retract. So get out there.
Yeah, they should. They need confidence in themselves, and if they have that, and if they know their product is good, meaning they know their business, they know their specialty, they know what they provide is as good as anybody can provide, no matter what podium they sit on, or what university they're in, or what city they're in. If they're confident that they can provide as good a care as anybody in the world, they need to tell folks about it. And once they do, the folks will come in.
I talked to a plastic surgeon the other day, and I said, if there had to be, what makes you different? He goes, I don't think I'm different anyway from any other plastic surgeon. And I happen to know that this guy literally has no business. He's using the wellness hair as a last hope. And I mean, he just said, you know, I think we're pretty much all about the same. I mean, we're all doing the same. I mean, I'm not one of those guys going to try to tell you anything different. I think that that's a sad position to be in. I think you have to find where you're different, find where your strength. You shouldn't be in the game at all if you don't secretly think you're good at what you do, or one of the best. What are your thoughts on that?
Well, I think you cannot live in your training era. You cannot. You have to, and most doctors do. You have to keep up with what's modern or current. Vein treatments were unpopular for 30, 40 years. New vein treatments evolved. We quickly looked at them, determined they were going to dramatically change the spectrum of treatment for vein problems. I was one of the first to look at it and decide, sure enough, this could, and I say repeatedly, this is one of the biggest advances in vascular treatment worldwide in the last 30, 40 years. And sure enough, it has been. And so it was my choice to say, well, this is something I need to focus on and make successful, and fortunately for me, that's turned out.
And you got out there.
I did it, and it takes courage. You have to say, well, I'm going to stop doing carotid artery surgery and lung cancer, and I'm going to do leg veins. That takes a lot of courage, but
there's power in being a specialist.
Well,
that when the word gets out, this is all he does.
Yeah, there's a lot of power. A lot of patients seek you out. I mean, our success, because of what we do, is not we do a fair amount of marketing, but our real success is word of mouth. Every patient they say, I've told 5 other people they've got to come see you.
But if you're busy, why the heck do you still have to advertise?
Oh, you never quit. You never, I don't think you ever quit.
I know Nike and McDonald's, they do it.
No, yeah, you never stop.
You
And
called it the modern doctor.
Correct.
Let's get out from your desk.
Right. There's so many doctors who decide.
Because you look old school, by the way.
Well, I probably am, but then I
But you're a
learned-
progressive guy.
Yeah, I learned early on that you never sit back and you never watch. If you do, the minute you sit back and stop, you'll be consumed by all around you.